Okay, we're going to talk about Chapter 27, Upper Respiratory Problems. So when we talk about problems of the nose and the paranasal sinuses, deviated septum, nasal fracture, rhinoplasty, and epistaxis comes into play. The couple of things that are important as far as deviated septum and nasal fracture is that they're in an increased risk for obstruction, nasal congestion, frequent sinus infections, nosebleed, and facial pain. Why is it important when we're doing an assessment or obtaining information on a history to ask if someone had a deviated septum or nasal fracture? We need to know this because if we had to place an NG tube in, that could play a part into what side we're able to put the NG tube in, or we may possibly need a smaller tube in order to insert it into the nasal passage. When we talk about epistaxis, one of the things we need to know is patient starts with a nosebleed. You want to set them up in a sitting position, have them lean forward with their head slightly tilted. We want to apply direct pressure for 10 to 15 minutes. Seek medical help if it lasts longer than 15 minutes. Keep them quiet. We don't want them being hysterical. They may have to have a vasoconstrictive agent. They may have to have it cauterized, and the medicine that they use to cauterize it is silver nitrate. Oops. The other thing they can do is anterior packing. It's essentially a tampon that they put lidocaine or epinephrine on, and they will stick in there to pack the nasal passage. They can use saline, but they also need to sneeze with their mouth open to avoid that sealed pressure. They need to avoid aspirin, vigorous nose blowing, strenuous activity, and they should not be lifting or straining for 4 to 6 weeks. These patients, as the nurse, it's your responsibility to monitor level of consciousness, respirations, heart rate, O2 sat, and risk for aspiration. Now we're going to talk about rhinitis. You do have a table on page 500, table 27-1. That goes over rhinitis. There are different types of rhinitis, as you can see on your PowerPoint. So if you guys review that, that would be wonderful. So now we're going to talk about influenza or the flu. It is A or B or C, and A is human and animal, and B and C is just human only. There are different types, different strains. They base on the flu vaccination based on what was the strain the year prior. So sometimes it's not always effective year to year. What are some signs and symptoms? Usually chills, fever, anorexia, malaise, myalgia, headache, sore throat. To know about influenza, it's droplet. It incubations in 1 to 4 days, so these people are very contagious in that time frame. The other thing is you can have complications with pneumonia from the flu. The elderly are typically at risk for getting complications of the flu and it being pneumonia. You can do a rapid flu. This is a nasal swab that's resulted in the same day. This is best used 48 hours on the onset of symptoms. And then, of course, as healthcare workers, we are in contact with many of different people, sick, non-sick, so it's important for us to get a flu vaccination, the elderly population, the very young. It talks about the flu vaccinations, the different ways that they're administered on page 504, 27-3. And actually the best time to get the flu shot is in September.